also thinking about the solutions of the future. You know, the best part of my job is to see impact. This is a colleague of ours in Ghana. His name is Alfred. He's working on our first prototype. So you saw the picture of the third one. This is the first prototype. And both of his kids have had malaria. But for him to be able to test the drugs, because he's a pharmacist, and understand what it does and doesn't contain, to understand what his community is getting, and hopefully do something about it is the best part of my job. And I want to maintain that connection with people, with communities, and hopefully see the impact, even if I'm not there myself. At the end, I want to sort of end the fact that my work in this regard is based on a fundamental belief. And this is what motivates us, this is what keeps us going, is that there should be a fundamental right of all patients, no matter who they are, what they earn, what they look like, their ethnicity, their religion, their creed, their location, that they get quality medicines when they need them. And there should be absolutely no compromise on that. And that what drives our work pushing forward. And I'm really sort of honored to work with really outstanding people who share this value, who share this vision, and allow me to sort of push forward with their help and their efforts. So with that, I'll end. And I hope there are other questions as well. And I'd be absolutely thrilled to hear from you.
Yeah, thank you, Dr. Zaman. There are quite a few questions that are coming up. I would like to launch a quick poll, right, to gauge the audience, right? So the poll should be displayed on your screen now to all the audience. If you could just take maybe 10-15 seconds to answer the questions. While we are waiting, Dr. Zaman, can you share some more experiences especially from Pakistan as well as other refugee shelters?
So, the challenge with Pakistan, and this is a sad reality, and I think we have to be frank about it, we didn't manage the refugee issues very well. In fact, some of the outbreaks in the late 1990s, driven with poor quality medicines, were actually in Afghan refugee camps in Pakistan along the border. And some of those were Pakistani manufactured drugs. In 2015, poor quality Pakistani drugs were routinely available in Afghanistan as well. And there was very little that was being done. And so I've spoken to colleagues about it. And, so one of the things, and here I'm sharing my opinion, one of the things that has really made a pretty serious, in a negative way, impact on Pakistan's healthcare system is the 18th Amendment. So I understand the autonomy that the provinces demand and need, but unfortunately, devolving health to a provincial matter has been a disaster. And I say that with the perfect understanding of what I mean and the word that I use. And it has been because, one, in the case of medicines, they do not require any permit. So a medicine made in one province can be sold in another and vice versa. Second, our provinces are not all equal. So Karachi has a little bit of a reasonable system, but rural Sindh does not. Punjab has a reasonably good system, but Balochistan does not. So what it allows you to do is you can create potential factories of poor quality medicines in, let's say, rural Sindh or Balochistan or elsewhere, and being able to sell them in Lahore or Islamabad. And there is no checks and balances because it is not a federally mandated system. The local DRAP, the Drug Regulatory Authority of Pakistan systems that they have are all good intention, but lacks the technical capacity. It really doesn't have the technical aspects that it needs to really enforce high quality drug laws in a country of about 210 million people. And part of the challenge then comes from large scale imports that we have. So with the Chinese imports, because we don't have good systems, we get all kinds of things, some good and some not so good, but they're not very well tested. Regarding your question about refugee camps, Zahir, that again is a challenge that needs to be addressed. Fortunately, The UN High Commission for Refugees is now thinking about this issue, but that's all I can say. They're thinking about it, which means that the burden lies on small NGOs, small companies, and there is an opportunity there to make an impact. And I am personally very interested in talking to colleagues who may have good ideas, even if it is a for-profit system, to really make an impact on the people who are most vulnerable. Oftentimes, we don't think hard enough, we don't go to those places, but I've been involved with the sort of some startups as well as some I would say hackathon kind of things that focus on refugee health, and there's just enormous amount of interest and a great opportunity there.
All right, thank you. I just wanted to share with you the poll results, right, for the very first poll that we launched. 33% think that this could be an in-country private services like testing mechanism. 40% think that we can have this product in partnership with government sector. 7% think franchising, and 20% says nonprofit. I will also launch a second poll, and then let me ask you that question while audience is working on their poll. How do you plan to scale your solution in non-regulated countries?
So that's an excellent question. It turns out